Welcome back. You're still watching SA Today. Now, health care stakeholders have expressed their dismay at what they say is the intention of the Council for Medical Schemes to discontinue low-cost benefit option schemes. Now, they say that this will have a direct impact on the poor accessing health care. The Healthcare Stakeholders Forum, representing over 200 organisations, marched to the Council for Medical Schemes offices in Centurion in Pretoria earlier today, where they handed over a memorandum. For a little bit more on this, we're now joined in studio by Healthcare Stakeholders Forum spokesperson, Buti Sigasa. Thanks so much for joining us. Welcome to the programme.
Thank you. Thank you.
All right, so many of us perhaps may have heard about the schemes that you're talking about that are under threat. But just explain to us where it fits into the healthcare story and why it's so important that you had to march and hand over this memorandum.
Thank you again. So basically, I mean, it started long ago, but the problem was triggered by Circular 80 of 2019. It was issued in December last year. So basically, the circular is discontinuing low-cost benefit options. So low-cost benefit options, you'll find them in medical aid schemes. You also find them in, insurance products, healthcare insurance products, and the Council for Medical Schemes is saying they want to align national health insurance, so therefore they are discontinuing healthcare insurance products or low-cost benefit options. So low-cost benefit options, I mean, like the name says, it's meant for low-income earners. Some of us do assist in negotiating these products, with employers. And in other instances, you'd find that these are workers who earn less and they can't afford your mainstream medical aid. So the alternative for them to access health care is the low-cost benefit options.
All right, so with the NHI, why would you need this low-cost benefit options?
When you say with NHI, I mean, NHI is not in place.
So is this going to, is there no period of time that's going to be phased out, or is it immediate? What's the...
Well, it's almost immediate, because, I mean, the registrar is saying these options are not going to continue beyond 2021, I mean, that's a short period, and we don't know what's going to happen then. We think that it would be reasonable for the Department of Health, for the registrar, to firstly phase in national health insurance, and and then phase out these products if necessary.
So you're saying that there's a danger that there could be a period of time that low-income earners may actually have no access to medical aid?
Yes, that's precisely what we're saying. That's precisely what we're saying. And you find that, these low-income earners, as we speak, they have medical aid subsidy, for instance. Most of them, they would have 50% subsidy. But they can't afford your mainstream medical aid, and therefore they are not on medical aid, although they don't have any form of healthcare cover, and they rely on the state.
All right, so again, help me understand, because at the moment you can access free health at the public hospitals, right?
Public hospitals, yes. I mean, the public hospitals are...
So what you're saying is that this is access to private healthcare?
Yes, to private healthcare. So you find, I mean, the same low-cost benefit options would have sub-options themselves. You'd have options where you can only have GP consultation, and other options. I mean, they've improved other options where you also get chronic medication, for instance. And I mean, at least I know, and I suspect that you may know, that, generally, people would want to consult the doctor. So primary health care is important. If an ordinary worker can go to the doctor and get medication, then in that way, the public healthcare system Well, it brings some relief to the public. We're not saying the low-cost benefit options are a silver bullet. We're certainly not saying that. But we are saying there is no need for the registrar to rush. The registrar can wait and implement, what they want to implement.
Have you made that representation that don't rush this? We're not saying don't scrap it once NHI is in place.
Well, he didn't show up today, so we couldn't make that representation.
And that's what's in your memorandum?
Precisely.
What reasoning have they given you about scrapping it so soon?
Well, NHI, I mean, the reason is NHI that they are introducing NHI, but they also say, that these low-cost benefit options, they create a burden to the state, because some of them, or most of them, this is what they're saying, require beneficiaries to use state facilities. That's what they say. Well, I mean, we can't comment on that because there was no proper consultation. Even when the circular was issued, there was no proper consultation. So it's difficult to comment when there was no engagement. I mean, the medical aid industry, it's a small industry. In most cases, when there's going to be major changes, there would be engagements between stakeholders.
So who is this stakeholder forum? Who's involved in this march?
Look, I mean, it's and I hope I'm not using an incorrect concept. It's a spontaneous reaction, of industry players because based on our previous experiences. Our previous experience tells us that the council doesn't listen. The council doesn't listen. In fact, if I may, just for a few seconds, take you back slightly. In 2010, the registrar issued Circular 10. They call it Circular 10 of 2010. So they issued a circular. The industry was up in arms. Other people appealed against the circular, and the appeal process happened within the Council for Medical Schemes. So the appeal happened at the appeals committee of the Council for Medical Schemes. And the outcome of the appeal was such that it agreed with the industry, and therefore it disagreed with the Circular 10 of 2010. But despite that outcome, the registrar continued to issue a press release in December 2015, contradicting the ruling of the appeals committee and confirming their own circular, undermining their own processes. So we have experienced that the council doesn't listen. And I mean, if you look, for instance, at the Medical Schemes Amendment Bill. The Medical Schemes Amendment Bill, from our point of view, is that it's going to destroy black businesses, among others. It is undermining, in fact, the proposals that are there. The registrar is contravening Section 7 of the Medical Aid Schemes Act, in that he is not protecting the interests of beneficiaries, But they are steaming ahead because
we're running out of time, okay. But what's the Minister of Health said?
We haven't engaged the Minister of Health. At this stage, we want to engage the registrar. After we've engaged the registrar, if we are unhappy about the outcome, would obviously escalate. We don't want to go to the minister and the minister sending us back to the registrar.
All right, Mr. Sigasa, we've run out of time. We're going to leave it there, but thanks so much indeed for joining us on the program, and let's see where this goes.
Thank you.
Thanks for your time.
Thank you. We appreciate it.